Now, at least 10 people have been killed in that gas explosion that happened in Boksburg. Yesterday's horrific incident left several others critically wounded, including some of the firefighters. The truck got stuck under a low bridge and caught fire. The blast also caused extensive damage to the Tambo Memorial Hospital. Health Minister Joe Phaahla is set to visit the hospital today, and senior reporter Silindelo Masikane is back in Boksburg and joins us now for the very latest. A very good morning to you once again, Silindelo. Perhaps just give us a sense of where you are located at the moment and if the minister has arrived yet.
Well, we are inside the Tambo Memorial Hospital. I'm going to ask my colleague Joe Phaahla to just come a little bit closer. We do have the minister here. He is assessing the damage inside the hospital. We know, of course, that there are a number of units that have been damaged. In fact, we've been walking through the casualty as well as the X-ray section of the hospital, which is where most of the damage took place. And what you can see is that the roofs, some of the roofs have caved in, a lot of damage to the windows, which were shattered. You know, the minister is just being taken through exactly what transpired during that blast. He actually arrived from Limpopo this morning to get a sense as to what transpired in this horrific accident. Like you said, 10 people who have tragically lost their lives. And at this point, we know that there are several people who are in a critical condition, including staff who were here when the blast took place, as well as patients who had to be moved from inside the hospital, and of course those who were injured from the blast. The last count we had received was that there were dozens, more than 20 people who had been hospitalized and taken to various hospitals in and around Johannesburg, as well as Boksburg. And so you will see from the visuals in front of you that we understand from a notice, in fact, that inspectors of the Department of Labour actually issued a prohibition notice for the Tambo Memorial Hospital, saying that the use of the accident and emergency unit as well as the radiology unit is prohibited. Therefore, they don't expect that these services will be in use until there are repairs, and that an occupancy certificate will have to be reissued afterwards. So when we walk through towards the casualty section now, you will see from the roof just how much damage there is. And we understand that during that blast, patients had to be evacuated quite quickly, and you know there were a number of staff members who had to be recalled from their leave, in fact, to come and assist doctors and nurses alike. And so at this point, we're just getting a visual sense as to just how horrific the impact has been.
It does look quite severe, and one can only hope, Silindelo, that it won't be another situation where the fire that happened at Charlotte Maxeke Hospital took the department quite some time to repair and get that oncology department that was affected back on track. Hopefully the minister will bear that in mind in terms of the urgency for all the health resources to be available, particularly in the festive season, Slee.
I mean, I don't think we can express enough just how horrified everybody has been, or the situation has taken its toll on many South Africans. Those who saw those disturbing images when the news broke just after 8 a.m. yesterday morning about this blast, you could see that there were many people who were critically injured. You could see people's skin peeling off. People had missing limbs, and we understand that mop-up operations are still recovering many of those limbs. And at this point, we just want to get a sense from the minister during his briefing what the damage, the extent of the damage, because at this point we are actually getting notices or hearing security here at the Memorial Hospital saying that they cannot accept any more patients, that if there are ambulances that are coming to deliver patients at this hospital, they need to be turned away. The hospital and its staff has been severely impacted, and at this point you can see that we are still just trying to get a sense as to where to from here. We do see that, in fact, outside, unfortunately, we're a bit too far from the actual scene. You cannot see it now, but emergency services as well as those cleaning up are on site, just outside of the hospital where the blast took place. And of course, Rafia, you would remember that we do know that the truck driver, or the tanker driver rather, did survive that blast, and at this point we understand that he's been hospitalized, and that police and as well as his employer are just waiting for him to wake up to just give more details around what brought him to this particular area, because during the press briefing yesterday by the Premier, we were told that the driver was a South African, that he was moving the tanker from Richards Bay to Botswana, and that they don't know exactly what could have brought him to this area or why he would have needed to try and go under that low-lying bridge. So just at this point, just assessing the damage here in the hospital, but of course getting reports about the fact that there are many who are critically wounded in various hospitals.
No, thank you very much for that update, Slee. And of course, hopefully you will get to have an interview with the Minister so that you can get a better sense of the immediate plans that will be initiated following that explosion. That is senior reporter Silindelo Masikane there inside the Tambo Memorial Hospital, giving us a sense of the extent of the damage. Of course, the Minister is taking a walkabout, probably being briefed about it all, and will give us a sense of what exactly is the status quo in that health facility.